For this next story, let me begin by asking you this. What things are you likely to find in schools? Books, computers, sports equipment. But in America, very soon, you will also find overdose reversal drugs. Such is the state of drug use in American schools that the federal government has now come up with a rather unique measure to stop the menace. The White House has urged all schools in the United States of America to stock up on Naloxone. Now, you may be wondering, what is Naloxone? It is a drug used to help stop an opioid overdose. According to reports in a joint letter to educators, the White House Office of National Drug Control Policy, as well as the U.S. Secretary of Education, has said that every school should carry Naloxone. They want the faculty and the students alike to be prepared to use the nasal spray in case of an overdose. The U.S. Food and Drug Administration approved Narcan, the brand name for Naloxone, for over-the-counter use earlier this year. So what does an opioid overdose look like? Life-threatening. It requires immediate emergency medical attention. What are the signs? When a person does not wake up or respond to touch or voice, when breathing is not normal, very slow, or has stopped, when their pupils have turned pinpoint size, they start showing bluish lips and nose. Naloxone is an opioid antagonist. This means that it binds to opioid receptors and can reverse and block the effects of other opioids such as heroin, morphine, and oxycodone. The medication can be given by an intranasal spray, which is into the nose, or it can be given into the muscle, under the skin, or even through an intravenous injection. The medication works by blocking the effects of opioids on the brain and restoring breathing. It must be given as soon as signs of an overdose appear. It works only on someone who has opioids in their system and not on any other type of drug overdose. However, it won't have any adverse effects if given to someone who has not taken opioids. Who can take Naloxone? Those who have taken high doses of opioids for long-term management of chronic pain. Those who receive rotating opioid medication regimens. Those who have been discharged from emergency medical care following opioid poisoning or intoxication. Those who take certain extended release or long-acting opioid medication. Overdose deaths among U.S. teenagers have been on the rise for years now. The Biden administration is now urging schools to buy and carry the opioid overdose antidote. According to reports, more than 5,000 American children and teens have died from overdoses involving fentanyl in the past 2 decades. By the way, over half of those deaths occurred in the first 2 years of the pandemic. Overall, 112,000 people have died from an overdose in the 12-month period ending in May 2023. This is according to estimates from the U.S. Centers for Disease Control and Prevention's National Center for Health Statistics. Fentanyl and other synthetic opioids were involved in the vast majority of those deaths. The latest push from the White House comes as it hosts its Youth Substance Use Prevention Summit. The event is aimed at raising awareness of the dangers of illicit drugs, reducing the stigma around mental health, and strengthening the safety of communities. But how serious is the drug menace in America? Very, very serious. A government study says that the number of American teenagers becoming addicted to opioids is on the rise. Illicit fentanyl is sold in various forms, including pills that are made to look like other regular prescription opioids. It's also commonly mixed into other illegal drugs like cocaine, heroin, to boost their potency. The result? Users are unaware that they're actually consuming fentanyl. A study published in the medical journal Pediatrics earlier this year suggests that more American teens are dying of overdoses that involve opioids. According to the CDC, between 2010 and 2021, the rate increased nearly 4 times. In such a situation, is stockpiling and anti-overdose medicine in schools the way to address the crisis? Experts say partly. The emphasis must be on making communities more aware. It definitely is a step in the right direction because it can be a launchpad for more conversation about the dangers of opioids and their consumption. The Biden administration also states that the push for Naloxone in schools is part of a broader effort to prevent drug use and abuse and to ensure that students remain alive long enough to receive help. But when playgrounds turn lethal, when drugs, guns and death is common in schools, it is alarming to say the least. WION World is now available in your country. Download the app now and get all the news updates on the move.